Hello, everybody. We've got Emaad with us today as well. And Emaad will be joining us on the Doctor's Lounge. I shouldn't say it's two lounges now, Emaad. It's not one anymore.
It's two lounges now, is it?
Yes. Well, you're sitting in your lounge, and I'm sitting in mine.
Well, I think this is going to be a digital lounge until we can get permission to be in one lounge again.
Yeah, absolutely. Absolutely. So how are things with you?
I'm very good. Very good. Keeping busy. Yourself?
Yeah, not bad. Not bad. For those of you who don't know, Emaad is a GP as well in Cardiff. And the idea is that we're just going to have a chat, really. There's been a lot of changes going around in the national service and the way we're working. And one of the first ones that which caught both of our eyes was the effects of COVID-19 on general practices and how general practices have been functioning and how we provide services. So we thought we'll have just a bit of chat about that, 15, 20 minutes, and then wrap it up.
Yeah,
so,
good.
Emaad, what do you think has been going on?
Well, to be honest, you said how the COVID pandemic has changed things, the coronavirus, but it's completely revolutionized the way we as GPs work. I know that obviously yourself, you're a GP, and previously to coronavirus, we used to have a system where patients used to come into the surgery and speak to the reception and say, I want to make an appointment with the doctor, and then they would give them an appointment, or they'd try and call up and make an appointment, and everything was done via seeing the patient face to face. Now, however, it's completely changed. So you can't just walk into the surgery anymore. You have to call up. You have to get in touch another way. So most people are ringing, or you can email in, or you can do this digital service that they've brought out especially in Cardiff and Vale. I'm not sure if it's elsewhere. Dr. Judd, you can fill us in on about this eConsult. So there's a huge number of ways to now access the service, but you won't see a doctor unless he thinks, actually, no, I need to see you.
Absolutely. I personally think it's really, really beneficial because, majority of the people use emails and eConsult. So eConsult is one of the options where you can actually go onto the surgery website and fill in a form. We ask you sort of, like a couple of questions, and you can attach photos as well. And then this is for something which is non-urgent, so this is not for something like chest pain or any other worrying things. And then the GP will have a look at those and get back to you, either to a message, the reply of an email, or even a telephone call. So that's eConsult. And then we've got, as you mentioned, what is now going on is the telephone appointment. So patients are ringing in, wanting to see. But the advantages I'm seeing there is that a lot of time, previously before COVID-19, patients would come in asking for a sick note and things which could have been very easily done over the telephones. And that sort of frees out time, because if a patient rings in and says, I want a sick note, and I know that he's got long-term illness, I wouldn't have problems giving them a sick note over the telephone. So it's freeing up that time. And there's things like skin rashes and conditions which actually you can just take a picture, send it to your GP, telephone them and send you a picture. What do you think that is? And a lot of time, these are the things which can be solved. So it's freeing up a lot of time. Now that's sort of the positives. What do you think? Is there anything else going on as well, if not?
Well, there's been a big debate, because obviously now, as GPs, it looks like we're not seeing patients. We are still seeing patients, so people have this impression that we're not seeing anyone. We're still seeing patients.
So who was that suggested? Was it Matt Hancock, or was it? No, it was the A&E, one of the A&E professors, who's actually suggested that GPs should start seeing patients. Oh my goodness! I mean, how do you say something like that without even knowing what GPs have been through, and how many GPs have died in COVID-19? I mean, is that not a sign enough? So we have to die in order to show our presence? I mean, come on. But anyways, that's another thing. Oof. That was quite funny, wasn't it?
Yeah, so we are still seeing patients. So that conception that some patients have, or you're still closed, you can't see the doctor. No, you can see the doctor, but we'll
Yeah,
speak to you first to see if you need to see the doctor or whether we need to prioritize other patients. Um, but you're right. The way is worked is that it's given us a bit of a negative connotation, but I think this is here to stay. I think, as you said, no, actually, Mac Hancock was saying, and the RCGP was saying that the old system probably won't come back because this new system is just so much more efficient. Because you see the patients you need to see, and the ones who can be dealt with remotely. And to be honest, for the vast majority of people, it's much more convenient to have it done on the phone or via email. Especially who are in work, the ones who are a bit more should we say, excluded a little bit or will be disadvantaged by that, of the elderly population who may be not so up to date with with the technology that we're using.
I think what's also coming with it is as well, because we know that our accident and emergency departments have always been sort of overwhelmed with non-urgent or non-accident or non-emergency care patients. There's, for example, we've got optician services available where if you've got eye problems, you can go to see an optician. If you need some sort of minor medication or minor ailments medication, you can go to the pharmacy. So a lot of times patients wouldn't know about these things, although they were there. For example, Boots. If you, for example, in Wales, if you mention I've got minor ailment scheme, so I want you to see me under that. The prescription, whatever they give, is completely free. It's paid by the government. So there are services available. It's not like you're paying from your pocket. You're still getting the same access and probably getting it quicker. But what I'm hearing about now, I don't know how much when it's going to start, but accident and emergency departments attendance really fell during COVID-19 because of the clear reasons of patients not wanting to go to the hospitals. But what's happening now, the second thing is, I think we want to keep it like that. And the way we're going to keep it like that is if we get it right the first time. So we send the patients to the appropriate site that they need to be seen at or dealt with the first time, rather than go to any and then they're telling you go to your GP, and then you go to the GP and GP is telling you go to the opticians. So it's like, you going through all these ping pong sites just for one thing. Might as well go to the opticians in the first place. And that's where the new 111 service is being utilized now, where Cardiff is going to have a 24-hour phone line service where you can actually ring up and be triaged and be directed to the appropriate service, which is, I think, brilliant. I don't know if this is happening somewhere else. Emaad, do you know anything about that?
No, to be honest, I've only recently heard about it from the Cardiff point of view. It's a very interesting scheme. So you can't, well, we say you can't walk into A&E anymore, but obviously if you have a very serious emergency, then they will assess that, and if you need to come in, you'll come in. So if you have your chest pain, or you've had an accident in a car accident, etc. But for more the grey area things, you'll be asked to call this phone number, and then they will direct you to whether you need to go to A&E, whether you need to go to minor injuries, whether you need to see your GP, whether you need to see the pharmacist. And I think it's very good in streamlining each patient to where they need to get what they need to get, rather than everyone just trying to go into A&E or everyone trying to go into the GP or wherever, and actually finding out, you could have saved a lot of time by just going somewhere else first of all. So I think it's making it more efficient.
It is, and one of the other things that I'm seeing, which are developing alongside the triage model, is the ability for the GPs to contact the consultants in the hospital. So, for example, there's a couple of apps popping up in sort of here and there. Different health boards have got their own apps in Wales. I'm not so sure about England, and we're going to find out hopefully and get back on that. But there's like eConsult apps where you can actually contact the consultants through an app, attach an image, which might be sent to you, or you've got an app, sort of a picture from a patient, of course with permission and confidentiality. Everything is going through the NHS sort of internet service, and the consultants can then sort of give their opinion on it, or suggest treatment, or follow up a patient on that. And a lot of consultants are in the hospitals are also doing departments, psychiatry, dermatology, rheumatology. I've heard about cardiologists actually ringing up the patients for follow-up because they couldn't bring them into the COVID-19 filled hospitals. And I'm sure they've actually realized that this takes far less time than the patient getting ready, sitting in the car, driving all the way to the hospital, being seen, being told something that they could have easily been told over the telephone or a video consultation. So that's brilliant. Thumbs up.
No, you're right. You're right. There's a lot of hospital clinics now. They're all being done remotely, so either via video consult or just telephone. So my dad is a pediatrician. He works in Bridgend, and yep, all of his consults at the moment are all telephone. So they'll still see patients they need to see.
How do you see a child though through because video, getting an attention of a child on a video is going to be a challenge.
To be honest, though, nowadays I find that kids they're so in tune with using phones.
Yes.
They're happy to stare at the phone and talk. So I
Yeah.
call my nephews and things, and they're happy just there. He'll pick up the phone himself like this, and he'll walk around with it, just talking to me, blabbering in nonsense. He can't talk fully yet, but he knows. He sees his parents on the phone doing the video calls. So you might actually see that they may be a bit more used to it.
Yeah, I've actually seen a couple of kids, really, toddlers, being smiley and happy, and suddenly start waving because they see you on a video screen when you're doing it. So it's quite funny actually, and quite nice. It makes you happy to see something different, So that's brilliant. Anything else new or pending? Anything new?
No, I think you neatly brought us onto video consults. I don't know what your thoughts are on the video consult. So it's basically essentially like a little Zoom call that you have with the patient, but maybe not really Zoom because there's some issues with the security around Zoom. But lots of different apps are popping up for clinicians to be able to use where patients can connect to their GP or their doctor securely. Have you come across many of those, Doctor?
Well, yeah. Well, I was thinking about this because, a couple of years ago, we heard that the private GP apps were coming along. So, things like, we're not going to name because we're not sponsoring, we're not being sponsored by any, but a lot of these apps were popping up here and there, and doctors were going to work for them, and patients were contacting them privately through the phone app, and there were video consultations in that. So these things have been happening, and there was a bit of a resistance of why they're coming in. There is the sort of fragmentation of general practice as we know it occurring because of that service, because you don't have the full history and your patients are getting treatments which you don't know about, so which might then cause problems in the future. And alongside that, I've heard about some other services where GPs have been providing remote triage to practices in difficulty. So practices which couldn't recruit GPs, for example, in far-flung areas, rural areas, they were being supported by other GPs working from completely different cities. And those things were a bit resistant, but now we're seeing that actually that idea wasn't too bad. I don't know what it means for the private businesses. If the services are streamlined, it's easy to access. I think, frankly, we need to up our game. We need to have apps. We need to have these things. One section, though, we shouldn't forget is the elderly of our, the patient population, which don't use a smartphone, don't use the internet, might not have anybody to help with that. So that we obviously need to make sure we take them along with us on this.
Yeah.
And there should be some sort of, provision for them.
Well, that's the challenge, isn't it? Because the ones who will use the service the most are that population you just talked about. And it's about how you can service them using the technology at the same time as trying to make yourself more streamlined. Some of them won't be able to do it. We have a few patients who said, no, I can't email. I don't know how to do a video consult as well. I'll have to see you face to face then. I'll have to have a look at the rash that you can't email across and see it face to face. But
Yeah.
I think over time things will be a bit better, but there will be a certain population who will just not be able to adapt to the technology.
Well, I just give you an example. I had, I was doing telephone consultation, and one of the patients mentioned that they've got a rash which is a bit bumpy.
Mm.
And I was thinking initially maybe eczema or things like that, or maybe urticaria, a bit bumpy. She couldn't explain it very clearly. I ended up saying, "Could you send us a picture?" I gave the email
Mm.
of the practice, and when the picture came through, it was shingles. And
Okay.
the treatment is completely different now, because
Mm.
if you not treat shingles in the first 72 hours, you end up with problems later on. So, or you could end up with problems. So, I mean, these things really do help, and it was quick, and it was, the prescription. The other thing is, I think, which we need to catch up with is electronic prescriptions,
Yes, 100%.
which is still not happening here. I mean, come on, that needs to happen. And if we had that, we wouldn't be trailing around papers, and we can work remotely.
Mm.
I think things could, work from home if you can, they say, or you
Yeah.
can't if you can't prescribe, over the phone or anything like that. So yeah, interesting.
Well, I think you're right here. The electronic prescription is one of the big issues that we are still behind with Wales, especially in England they have it, but here in Wales we're still, from what I understand, very far away from having that in practice. But that aside, one of the main things that obviously we're missing now, we're doing things remotely, as you said, is the physical examination. Now, I don't know if that's something that will become less and less practice if this is the way we're going forward, or whether the technology will catch up so you have the possibility to do examination. And well, I don't know. This is a theory in my own head about getting technology that provides you with haptic feedback. So if you don't know
Yes.
what haptic feedback is, at home is
Google
basically,
it. Google it.
yeah, it's googling. I remember doing training when I was in med school. We had the training to do the laparoscopic surgeries, and they had one machine in one of the hospitals which gave you haptic feedback. So if you're pressing against the liver, it would have the same tension as the liver. So
Yeah.
I don't know. If I think that's very far away still. But if we could get haptic feedback via video consult somehow, that would be the end of face-to-face.
Brilliant. Yeah, absolutely. We could hear the chest. If we could sort of palpate, that's it. Like we could have robots or something. So I think Apple needs to work on it. Yeah, that's a hint.
Yeah.
That's very nice. I think we should call it a wrap today.
Yeah.
A little short podcast. Hopefully next time we talk about some locums and issues locums are facing, or practices.
Yeah.
And so if anybody's got any questions, drop them through. And we'll see you again. Thanks for watching or listening.
Thanks for watching, guys.